Well, I specialize in interventional cardiology, and but I also do clinical cardiology as well. So, interventional cardiology is where we do cardiac catheterizations and do stents for patients who come in with threatened heart attacks or heart attacks. But I'm also a general cardiologist, meaning we take care of a whole gamut of cardiac issues that are sent to us for consultation, ranging from arrhythmias to people who have weak hearts or heart failure. Patients typically come because they have symptoms or clinical findings that are suggestive that they have cardiovascular disease, and it's up to us to further evaluate, work that up, and find some way to help them treat it. Amongst all the fields of medicine, cardiology is very, very unique, and that is because it is a field that is so highly studied with incredibly powerful studies over the last 30 to 50 years to show what works and what doesn't clearly and irrefutably for certain conditions. And so it's a real gratifying feeling when you're a cardiologist to be able to help patients with specific diagnoses that we find out, because we know that the advice we're giving them is irrefutable, that we can give them advice as to what will help and what's likely to prolong their lives and decrease their risk of future cardiovascular events. I think the thing that I want to convey to patients right off the bat, I really want to help them with the issue that they need addressed, that I am very interested in helping them with that issue, even if it's not a cardiac issue, even if we go through numerous studies and find out that it's not their heart, it's something else. If I can help lead them in the correct direction to help them solve those issues, then I think patients appreciate that. I have a great team of colleagues here, really I do. Having this group of people together to discuss with each other a broad scope of issues and diagnostic capabilities that we have for patients is very beneficial for patients, and also likewise gratifying for us. When patients come in with a threatened heart attack or a heart attack, and we take them to the cath lab early, either urgently or within 24 to 48 hours, we literally save lives with what we do in the world of cardiology in that particular circumstance. But even in situations that are less dramatic, many of the studies that I previously alluded to that have told us what things work and what things don't work in the world of cardiology have found out what improves cardiovascular mortality, like making people live longer. Advice we can give them that is going to actually change their life and make them live longer and better. Well, I think the most fulfilling part of my job is when I walk out of the hospital every day. I always want to feel like I made some positive impact on my patient's life, like that I really tried to address their problem earnestly. It's a good feeling to walk out of the hospital knowing that you did that.